Hello, my name's Renae. I'm a senior sonographer at CQMI in Rockhampton. I just wanted to spend a bit of time to speak about what we expect or like to have in students that visit our clinics. So we're after students who are happy to be here, like to get involved with the patients, always willing to give a hand whether we prompt you or not. We like somebody who asks lots of questions. We may not always know the answers, but it shows that you're interested in what we're doing and you're thinking outside of the box. Coming into clinics is a lot different. Nobody can prepare you for it. You don't read what to do in textbooks. So you need to be prepared for, I suppose, conditions constantly changing. Patients aren't always willing to cooperate, so it's about being able to adjust to different environments that you're not familiar with. Communication is a very big key when you're coming into the clinics. You need to be able to speak precisely and give short, prompt instructions so the patients know exactly what they need to do at all times. With sonography, obviously we need positions of the patient to change. So you need to be very clear with what you're wanting. You may also need to be able to give physical cues as well as verbal. When you're coming into the clinics, we expect you to look professional, so wearing your CQ University shirt, also black pants, closed-in shoes, being aware of workplace health and safety regulations as well, so very minimal jewellery and makeup. We expect you to be neat and presentable. Hair needs to be tied back, especially if it's long, and you need to be well presented. So making sure you've taken the effort to iron your clothes and coming to the clinic so you're presentable. So when you're coming into the clinics, you're actually probably in a job interview every single minute of the day that you're here. So whether we are in direct contact with you or speaking to you through other people, we're always analysing you and your behaviour and your attitude towards work, patients and anybody else that you come in contact with in the clinic. So you need to be very positive, willing to help. We look for people that are generally interested to be here, interested in what we're doing, asking questions, making sure that you're also confident to speak to other members of the staff, not just in the sonography area. So coming into the tea room, being able to have a conversation with people that obviously you're not spending a lot of time with. So while you're out on clinical placement, you should treat it as a job. If your hours are working 8 a.m. to 5 p.m, then we expect you to be there for every minute of those hours. So making sure that you're arriving at work so that by the time the first patient arrives, you're ready to take the patient straight in or follow the sonographer that you're with for the day. So we do expect you to be on time, and we expect you to stay the whole day until the end of your placement. It's not acceptable for you to be arriving late or thinking that you can leave early even if there's no patients. So while you're out on placement, it's also an idea to try and speak to other sonographers, even if they're not your supervising sonographer, just to get an idea if you feel like specialising in a different field of ultrasound, getting to know how you can get job offers or know of jobs that are coming up in other practices and clinics, I suppose, in the area and around the region as well. A few little points that I really want you to take note of is when you're going into the clinics is that yes, we are judging you the whole time you're here. So we expect punctuality, professionalism and being able to communicate with us and our patients. So if you're showing us that you're eager to learn, that you are generally happy doing ultrasound, then we're going to be considering you for a job position within our company.